membership team here at IRSM. Your host today is IRSM fellow Hugh Maxwell. Before I hand over to Hugh, I'm just going to go through a few things first. To begin with, you should see the right of your screen a toolbar with various options. You will be muted for the duration of the webinar. Feel free to ask any questions, make any comments using the chat function and the panel will do the best to respond. Any questions that we might not have time to answer today will be added to a Q&A document and uploaded on the website after this session. If you need any support using GoToWebinar, the I symbol will take you to the support site. Finally, this webinar is being recorded and a copy of the recording will be placed on the IRSM YouTube channel after the event. Okay, that's enough from me. I'm now going to hand over to you, Hugh.
Thank you, Suzanne. Thank you, Claire. Thank you, RSM, for this opportunity. My name is Hugh Maxwell. I'm actually a fellow of the RSM. I've been associated with the RSM for over 20 years, and I have the honour of chairing this, which is the third COVID-19 Recovery Network panel. We'd like you really to ask questions and to share your experiences with us as we answer a number of questions which have been put together for the purpose of today's panel. First and foremost, I'd like to introduce you to the members of the panel from a mixed number of backgrounds who have extensive experience which may help to benefit not just the RSM but yourselves in your efforts towards COVID recovery. So without further ado, I'd like to go ladies first and hand you over to Pamela to introduce herself, please.
Good morning, ladies and good gentlemen. My name is Dr. Pamela Gallatley. I'm the CEO of Healthcare RM, and I've been in health risk management for about 35 years now. I'm particularly interested in musculoskeletal and mental health disorders. Thank you.
Thanks, Pamela. Look forward to your inputs here. And to Peter.
Hi, I'm Peter Kinsella. I head up the health and safety consultancy at Cardinus Risk Management. My area that I'm looking at today is very much around remote working, and I'll look forward to sharing my experiences with you.
Thank you, Peter. I think that's something that a lot of people are doing now, which they weren't expecting. If we'd had this question 12 months ago, you're working from home today, that's the last thing we'd be expecting to say we're doing. And if I can introduce you to Gary Grant.
Good morning, ladies and gentlemen. My name is Gary Grant. I'm the Managing Director at Pyrelec. Fire safety is what my expertise is, hopefully, on this panel. And even more so than now, a lot of things that people have to think about, even with regards to COVID and how it impacts fire safety. So hopefully I can answer some questions.
Thanks, Gary. Looking forward to your input as well. It's great to meet you. And somebody I've known for a number of years in different guises, Mr. Ford. Mike, could you introduce yourself, please?
Hello there. Good morning, everyone. My name is Mike Ford. I'm the global lead for EHS and sustainability for a company called Avetta. My main areas of, hopefully I can bring some expertise to, is around the human capital side and supply chain risk. So really looking forward to this session today.
Thanks, Mike. I'm looking forward to sharing some of your inputs there as well. And last but not least, a young gentleman, a young star from 2019, who had the pleasure to mentor as a part of our partnership through the RSM, Grant Thompson.
Morning all, my name's Grant Thompson. I'm the Health, Safety and Environmental Manager for Two Sisters Food Group, working in their bakery division specifically. And I'm here today to talk about the communication side, particularly within food manufacturing and the factory environment. So very much looking forward to it.
Thanks, Grant. So as you see, we've got a very strong team of panelists here with some great and varied experiences to share with you. Now, before the format today, we're going to probably answer 6 or 7 questions that have been fielded already. But the first thing we like to start with is a poll, really, to find out how COVID has really impacted on your workplace. Suzanne, are you ready to field the question for the poll, please? So, for the quick poll we'd like you to answer, if possible, online, we'd like you to share with us, is your workplace now operating at pre-pandemic levels? I know we're in the middle of this situation, but it'd be good to see just what level of recovery you can share with us. And the options are, yes, we've embedded new procedures and processes. Number 2, no, we're still making change or adaptations. Or number 3, not sure. And we'd like to ask all of our attendees to share their vote into each of the categories. If you haven't voted, please do. We've got a few more seconds to allow the votes to come in.
I'm just going to give about 15 more seconds.
Okay, Suzanne, thank you. So, Suzanne, the results are in, and it's great to see that the strongest response we have here is 61% of our returns are showing us yes, we've embedded new procedures and processes. Over a third of responses are still in the process of making changes and adaptations. And I think there's quite a few businesses are in that situation because of this second wave that we're experiencing at the moment. And it's good to see there's only 4% are not sure. But what I would do, say for those 4% that aren't sure, contact your local managers, contact your local HR, HSC, risk management contacts, and try and ensure you know exactly what's happening in your workplace to ensure that if you do return to work, it's safe for you to do so, and you know what control measures are in place. So thank you for sharing that with us, audience. So what I'd like to do now, unless there's any questions or comments from the panel on this, is to turn over to the questions. And the first question I'll be fielding to our panel, to all of them, is although we want to recover to normal, how would you balance this against the ongoing threat of this second wave being unexpected? And I'd like to start with Grant Thompson on this one because I'm picking on him as usual. Okay, thank you.
Thank you, Hugh. I think if we cast our minds back to this time last year, if you'd asked any low or medium risk organisation, is protecting people from infectious disease one of your business goals? I think we'd all agree. I think the answer would be a resounding no on that one. I think now what we're finding is it's become a very conscious and deliberate goal affecting all industries and all different sizes. I think leaders themselves have also woken up to the threat of getting safety wrong now. I've seen it myself within Two Sisters Food Group. We've had some factories, 500 to 800 employees who have had to close due to outbreaks. And these closures have had a massive impact on the business financially, the supply chain financially, which I'm sure we'll come on to later, and also the workforce from a mental health perspective. So leaders don't want to get safety wrong. So I think to answer the question, Hugh, yes, we all want to return to normal. However, I think until that R rate drops to measurable levels or we discover a vaccine, I think we've got to demonstrate through our risk assessments that we're controlling the virus. I think for larger workplaces, for example, thermal imaging cameras, that's becoming the norm now, or almost the minimal the expectation. So I think the HSC, local authorities, public health, I think they're all doing a great job of making sure businesses are doing what they're doing. And I myself have had dealings with all three in recent times. So I think that sites should manage from day to day as if you were to get a knock on the door from one of those three tomorrow. And I think it's mentioned during other panel discussions as well about incorporating infectious disease into the business continuity plans. So if not done so already, I think it's vital that senior teams press on with that and get prepared as much for the future and for a second or third wave that may have a direct impact on their business.
Thanks for that, Grant. That's a nice in-depth answer there. Michael, coming from a similar manufacturing background, have you any views, anything to add to that, please?
Yeah, I mean, the sector I work in now is very different from the manufacturing sector. I work in a SaaS business now, but I think the interesting thing for me, especially in terms of the potential of the second wave, if it's not already here, is maintaining consistency in how you apply your rules. I work for an American employer, and literally from day one, we followed the guidelines from CDC and also the European Centre for Prevention of Disease, and we've consistently followed that. And we review this on a weekly basis. One of the biggest challenges I see for other industries is we have a lot of people working from home at the moment doing remote working, and I just don't think the issue of home working is in the British psyche in terms of employers. It's just not there. I don't care what they say. I've had employers where they've said it's a home-based job and you're not in the office. Well, why aren't you working? But coming from an American employer's background where it's pretty standard, it wasn't too big a challenge in terms of getting people to work from home, because it wasn't really that much of a cultural shift. And the big thing for me, and I don't see it happening a lot with a lot of the companies that I know of, is reassurance from the senior management. I mean, in safety, you're always taught about leadership, but if you're not getting consistent communications on updates from the senior team, then it leads to a lot of the problems that we're experiencing now with the inconsistency, the application of the rules. And I think the consistency side is the thing for me. I mean, I'm living in a region now which is under tier 3 lockdown, and yet my colleagues are in tier 2. So, and then we've also got colleagues working in other parts of the world where the restrictions are incredibly severe, you know, Melbourne and places like that.
Yes.
So our big thing is consistency in applying the expert opinion, not YouTube experts, but proper experts. And then where applicable, the country-specific rules we apply as well. And I think that's the key thing, is monitoring on a regular basis. Grant's approach around business continuity is also essential, and hopefully we can touch on that a little bit later.
Thanks for that, Michael. That's a really good answer. Thank you. And I think, you know, it puts a whole new focus on felt leadership and communication, because when you're remote, you do feel remote. Peter, could I bring your views in on this one, please? Because you mentioned about home working and the focus you guys have had through Cardinals.
Yeah, I'm very happy to do so. I think listening to what the other guys have said, there's three real key areas here. So one is that messaging, and it needs to be simple enough for people to be able to understand, whether you're at a senior leadership level or somebody who's on the ground. Second one is actually planning. Now we talk about, you know, sort of how we all got to this point. If we remember back to late March, there was huge amounts of issues with people actually moving to home working, and the, you know, sort of the issues with you know, business continuity plans falling over because they didn't work quite as they were anticipated. And then there is also an expectation of where we're at now to where we're likely to be in 6 months, 12 months, 18 months. And I think, you know, coming back to some of the discussions around this, is that our expectation should be that this is a long haul. So for organisations, you should be planning to actually look at your health and wellbeing programs, your you know, your risk assessment programs, to make sure that we normalise some of the stuff that takes place today, so that, you know, we can actually gear ourselves up for what is potentially going to be a second, a third, a fourth, a fifth pandemic that we're going to have to cope with. Come back to the point about remote working. You know, we've used the term home working as a way to emphasise of where we operate from at the moment as a result of the pandemic. And again, if we actually have a look at this, this is very much a shift in where we were pre-March. So if you look at the global workforce, probably about, you know, less than 10% of people actually acted as remote workers in the workforce, and there are some good data around this. But for me, what we should be looking at is actually what is it as an organisation we want to achieve. And I think also the other thing as well is that messaging needs to be really clear. And for that point, we need to be able to help people really clearly understand there are 3 things to combat we can do personally to combat this issue. So one is social distance, the second one is maintain our personal hygiene, and the third one is operate in a place where ventilation is good. And I think what we need to do is actually have clarity of what we're doing at the moment. I think I'll stop there because I could go on forever.
That's excellent. That's great. It gives you good coverage, but it also puts this, this self-reliance as well. The fact we've all got to take accountability and responsibility for our own actions to contribute to minimising the impact of COVID. Gary, coming from a different perspective, is there anything you'd like to add on this one?
The fire industry by default fall into that key worker bracket, whereby we've constantly, right through the initial lockdown, right through the whole process, been active and continued to work, because fire safety doesn't go away. COVID is here. There are lots of businesses out there that I feel it for. I'm grateful in that respect that fire safety doesn't go away. It's legislatively driven, which means that it's one of those sectors that that seems to be unaffected by the direct impact that a lot of other businesses are feeling. So from that aspect, our normal is still what we do. The changes that we've done, we've realised that we don't need to have an office. The senior consultants, there's lots of people can be more productive with their time instead of sitting 2 hours in the car going off for a meeting. This format of communication and meetings, VCs, this is the new world. And
yes,
whether we like it or not, this is how we're going to have to get used to how we do things, certainly for the short term, if not for the long term. There are pluses and there are minuses. But we started off at the beginning, loosely before the webinar came on, about that lack of social contact when you're doing VCs. I was fortunate enough to go out to site last week and I met some people. And it was refreshing, and it just gives you that sort of uplift in your own self-being, that you're meeting other people. So we're all human beings. We all need to have that tactile experience from time to time. So where we're all doing so much on VC and not having so many meetings, yes, there's the pluses. We're not driving all over the country causing pollution, etc., etc. But it has its negatives. So
certainly does, Gary. Yeah.
Who knows what's down the line?
Gary, thanks for that. And I think it's a good point here to pass over to Pamela, coming from the experience of being the MD in the healthcare industry. Have you got anything that you'd like to add to the comments from the wide range of participants have just shared?
Yeah, and I think it is coming from that health issue. I think what surprised me is I attended pandemic conferences 35 years ago, and there was the talk, it's going to be next year, it's going to be next year, it's going to be next year, and of course it never happened. And I think like Peter, we could be in this situation now where this becomes more of a norm because we see more of them. But I think my particular interest is the fact that what COVID has actually shown us, and it actually certainly does align with the data that we see on other conditions, is that certain people are more vulnerable than others. And therefore, I think in the risk assessment process, what we need to look at is that vulnerability of our people. And I think some companies might be thinking, oh yeah, but COVID is going to be over in 6 months or 9 months or whatever time frame we put on it. So it's a little bit of a waste of time to actually identify what those vulnerabilities are. But we've actually found that if you look at those vulnerabilities, and it's things like excess weight, inactivity, age, underlying medical conditions, ethnicity, all the things that we know that have come out of COVID, but those vulnerabilities are also the same vulnerabilities that actually cause things like musculoskeletal disorders, mental ill health. They are underlying issues of our society. And therefore, I think as part of COVID is that opportunity now to actually try and put a positive spin on it, to say, look, we know that our people are more vulnerable, some more than others. And therefore, in terms of returning to the new normal, I think what we need to be looking at is how we protect our people and protect the vulnerable, the old and those with medical conditions and the high risk factors. And by doing that, that will allow us to actually return to normal and the new normal a lot quicker.
Sorry, I was on mute there. Pamela, that's great, and that's a great point you make about this protection strategy moving forward. With that, unless someone's got anything else to add in question 1, could I move on to question 2, which is much more specific to wellbeing or health, where the question asks, what specific wellbeing or health issues have you seen a significant increase in, and how should we be approaching these? And are there any remote risk assessments we can do? How do we follow these up, Pamela? Be interesting to get your view on this one, please.
Yeah, and obviously the big one, and I mean Gary's touched on it, I think a number of you have touched on it, is the mental health side. We're actually seeing, you know, particularly with the younger people, and I think Lord Willits was actually touching on this a few days ago, is mental ill health in the younger people is an issue anyway. We actually see a higher incidence of that in both males and females under 29. But what we're now actually seeing with COVID is a lot of what these people used to do, and particularly their social activities, has been taken away, and they've had no exposure to anything like this before. So we're actually seeing a big increase in that mental ill health, but it's actually coming across the age groups as well, because there are people getting anxious about their future. They're also getting depressed because, going back to what Gary said about, you know, it was lovely to actually meet some real people as opposed to just be on VC. That is very important to us. We have that need as human beings to have that social interaction with people. But certainly I think the other thing that we mustn't ignore, that I'm now starting to see, or we're starting to see, is things like your musculoskeletal disorders. When people are sitting at a desk at home, or a kitchen table, or on their bed, or whatever else that they might be doing, and certainly they need DSE assessments. But you know, that lack of activity is, we're actually starting to see, cause more musculoskeletal disorders, and I think we're going to see that coming forward in the future. What we're also seeing as well is the amount of weight that people are actually starting to put on. And this is just going to make matters worse. So it will make your musculoskeletal and your mental ill health worse, but it could increase the risk of diabetes, cardio issues, a whole host of things. So I think what we're almost now building is that well-being, and I think Peter touched on it, the need to actually look at our well-being and what we do. But it's almost like that pot that's actually sort of bubbling there, that I think is actually going to come out later. We can actually see with operations not being available in the NHS, you know, people are not getting treated. So coming back to the virtual, and can you do things remotely? Yes, absolutely. You can actually sort of do your DSEs remotely. You can do CBT remotely. You can do musculoskeletal functional movement screens remotely. Almost whatever we can do face to face, there is now a virtual alternative. So certainly physiotherapy can be done remotely, and it can be done by telephone, but it can also be done by VC. With CBT, it can actually be done online or by telephone or by VC. So almost any assessment, there's now a lot of people within the health industry that have actually converted their assessments to the ability to do them virtually. And there's some new technology that's coming out as well that is actually making that even more interesting. So I don't know whether that covers all of the points, Hugh, in terms of that sort of question.
Thanks, Pamela. Yeah, it's excellent. I think, and it's great that you're actually probably, well, illustrating a lot of people the fact, you know, again, we're making best use of what information technology is available. You know, despite the fact in changing working patterns, we do have the solutions out there to try and really overcome and abate some of the other problems that may be developing as a consequence of this. So thank you for that. Anybody else anything to add? Sorry, Pamela, back to you.
And I think it's exactly that, isn't it? Is we adapt, and we're very good at adapting. And I think some companies have adapted better than others, probably as your poll showed as well. But certainly, yes. I think the ability to do remote assessments, people not be aware of them, but you can actually do both remote health and safety assessments. I mean, we're doing remote vehicle assessments and DSE assessments. But also, I think it's the fact that you can do remote interventions such as clinical treatment, such as physio. And I think people need to be aware of that, because otherwise those people could go without treatment, without an intervention, and in a few months' time, building up an even worse problem.
And I think there's a big opportunity for the likes of yourself, Peter, the companies and services that you provide, to actually make people aware that these services are there. And I think more and more they'll buy into them. We're still going through a massive change program at the moment, but people will have to take up these as people's working patterns change, I'm sure, to the advantage of everybody. Any more comments on this question, or should we move on to question 3?
I would just pass one small comment. You know, what Pam said should actually make companies stop and think for a moment or two about their health and wellbeing programs, because in the past, when we've looked at health and wellbeing programs, it's been very much aimed at, you know, promoting small areas. And I think, you know, when I sort of answer the next question, one of those, you know, sort of key points is that if we look at health and wellbeing pre-March to where, you know, to some of the issues that Pamela's raised, they are actually very different, and we should be focusing on those risks rather than the ones we've done previously.
That's a very good point there. Sorry, Pamela, please.
Yes, I sort of totally agree, and I think it's this whole link that, you know, well-being shouldn't be a nice to do. It shouldn't be something that is pink and fluffy. It shouldn't be, you know, just a little bit of know your numbers and the things that some people do. It should really be looking at how can well-being improve our health and safety risks, and how can well-being actually be an integral part of our health benefits, as opposed to just be something that's tagged on the end. And I think that's why COVID is an opportunity, because we now know that the people that are vulnerable are those that have got the risk factors, and we can now treat it like a risk instead of treating it as something which is just a supplementary benefit. But I think also encouraging individuals to actually look after themselves is extremely important in all of this, and it goes back to that social behaviour and everything else. I think to actually put the onus on the individual is also important, because at the end of the day, only they can make it happen.
I think that's a really valid and essential point that people need to really leave today, and also the previous meetings with. How much of this self-ownership's got to be in there in terms of making us change as individuals? In some ways, really developing greater personal resilience. If overall we're going to have much stronger organisational resilience dealing with things going forward. So I think it does come down to us as individuals all to play our parts, whether we're safety, risk professionals, whatever part of management, whatever part of the organisation we really are. Thanks for that all. That was a really good answer. Coming on to question 3, Peter, you don't escape, I'm sorry. Right. In terms of the next question, Dr. Fielders, with more home working and with this looking more like to be the long-term solution or the norm with changes in practice for many businesses, what type of elements should the risk assessment actually cover? And do we need a visual risk assessment in everybody's home, or do you think we can do this remotely? Cardinus have been at the forefront of this for a long time. Love to see your views on this one, please.
I'm going to reflect on a couple of things in answering this. So one was listening to Mike when he, you know, started off with the answer to the first question. Was very clear on that remote working has been seen culturally in different parts of the world very differently to here in the UK. That there is an element of home working that, you know, sort of sits as being very informal and a bit of a perk of the job. And all of a sudden we're starting to see that, you know, actually we're in for the long haul here, you know, as we're all finding out. And I think it's really important that what we do is we sit down and actually have a think about what we want to risk assess and what's the process we need to do to actually undertake that. Now, if you look at the term home working that we're using at the moment, this has actually been forced upon us by government. Okay, government have actually said to us, off you go, you know, guys, on the 23rd of March, you know, we are home working for those of you that can work from home. But in reality, you know, sort of remote working has been with us since the 1970s and was very much, you know, something that was researched and looked at, you know, in the US. And they coined a term teleworking, which is something that's actually being used by academics, by the International Labour Organization, the ILO, OSHA EU, and OSHA in the US. So I think, you know, what we need to do is really sort of take a little bit of a step back and actually have a look at this on what we're trying to achieve. And the term itself is actually based around using information technology in a location that's away from the main workplace. So again, I'm sure that most home workers at the moment have a laptop or some form of portable IT device that they're using to communicate remotely with, you know, the head office or the centre of the organisation. So, you know, starting off at this point, what I would say to you is that before you even start to think about what you're going to risk assess, you need to really sit down and think about actually what is home working, remote working, teleworking to us as an organisation, and what is it we want to achieve. Now, a lot of organisations that we've been in discussion with aren't going to return to work until January, and when I talk about return to work, that's the head office. There's an awful lot of organisations that are looking at, well, actually, we're performing pretty well with the guys at home. You know, productivity is where we hope it would be. In some areas, it's improved. You know, feedback from staff is that they actually enjoy the flexibility of being able to work away from the main workplace, because there isn't that hours commute each way. And also, there's one or two of us that are actually enjoying dinners with our families as well. I'm not sure that everybody is, but you know, from what I'm hearing, there's a number. So there are some real positives out of this. I would ask you though to hold in mind what Pamela said about mental health issues. So, you know, and I'll come to that in a second. So for me, before you actually undertake a risk assessment, I would actually sit down with your leadership group and your HR team and talk about actually what is home working, remote working, or whatever you're going to call it. And from research, there's 18 terms that are used regularly for home working across the globe. So, you know, you also need to be able to set out, you know, in contract, the boundaries and expectations of the organisations for people working. And those boundaries are things such as working hours, because that really does affect us. You know, expectations around actually things like, is it okay to send an email at 9 o'clock at night to your colleagues and expect a response? You know, my feeling it's not, because it's not good for us. But you know, we should actually look at stuff like this. We need to agree from an organisational perspective, you know, what a minimum standard from a workstation, home workstation looks like, you know, and how's that going to be funded, and how are we going to actually manage the equipment if, say, for some, you know, somebody leaves the organisation, because there is cost involved in this. So, you know, actually having a look at, you know, the whole process of who owns what. Then we need to really take our experiences from this time to consider the type of health issues that people are, you know, have been raising to us as an organisation. And one of the key things that we should look at is that, you know, there are going to be prevalences of issues that we know within our teams. So some of it could be reported into the line management team, or maybe that actually people are finding it quite difficult to, you know, communicate within the various teams. So we should look at this. And then we also need to remember that, you know, we are guided by government, so we need to actually make sure that we follow the HSE's guidance on this, so that we look at, you know, the key areas that are highlighted on the HSE's website as it sits today. So that's lone working without supervision, working with DSC, and stress and mental health issues. But there are others. So again, you know, Gary's specialisation is fire safety. So, you know, do people have a fire safety plan at home? Do they have a first aid kit? You know, have we got processes in place to make sure that people can report issues? Do they know how to report issues? Are they aware of the AAP that's available to us? You know, within organisations, is there an AAP available in an organisation? There's a whole raft of it, you know, questions we should set ourselves. So when you're setting your risk assessments, you know, in reality, what we should be doing is looking at the organisation, the complexity of it, and signposting people to make sure that we get people to the right place. Again, picking up on what Pamela said, we also need to consider the vulnerability of people. Now, she did speak about, you know, the whole aspect of our individual health, but there are three key areas I'm going to, you know, sort of just touch on. So one is that within all the research I've done on remote working, teleworking, home working, the biggest issue that seems to come up and in research over the last, you know, sort of 20 years is about loneliness, about working away in isolation from people, even if you're part of a family group or a bubble, is actually feeling lonely, you know, in yourself and away from an organisation. How many policies sit in an organisation to help with loneliness?
Yeah, right, that's a good point there.
You know, I'm not sure.
Yeah. Sorry, just on that point, I know we've got 2 more points to make. We've just had a very good question aligned to this coming from John Valgello. I do apologise if I pronounce it wrong, John. And he's actually said about, for many people, working in the workplace may actually be a better option, a safer option, because of the mental health being and home issues and relationships at home. How do the panel feel the guidance that's been given regarding working from home from the government is? Do you think it's sufficient, or do you think they could be doing much better with that?
If I was to answer that question, the government can do better, but I think a lot of this is based around research and actually the advice that people get in, you know, that business leaders are getting themselves. Because again, one of the things that, you know, comes from research is that most organisations probably only undertake 50% of the risk assess, risk assess only about 50% of home workers. So, you know, we need to do more on that front.
Thanks, Peter. Thanks. I wanted to get that next. I thought that was touching on the stuff you just covered. Sorry, you can please carry on with the points you're making.
Okay, I will be quite quick on the rest of the bits and pieces. So I've spoken about loneliness. The second one is presenteeism, and this is a really important thing. So presenteeism really is, you know, the chap or the worker that gets up at 7 o'clock in the morning and is still on his laptop at, you know, sort of 9 o'clock at night. And in reality, you know, organisations should be actually looking at this as a cause for concern. You know, we need to be able to make sure that, you know, people actually understand the boundaries they operate within. So formalising this whole approach to home working is really important. And then the issue that Pam raised around musculoskeletal disorders, the issue that we're facing at the moment is that if we are home working, what are the opportunities for exercise during the course of the day? So there's no longer the walk to catch the train or the walk to catch the bus. There is no longer, you know, the opportunity to walk to the office or go for a coffee or go out for lunch. You know, there is more of the mindset is very much driven around, I need to be available, and this comes, you know, brings that circle back to presenteeism. So I think, you know, when we look at this for the long term, we really do need to consider this whole topic. And then to answer the last question about should I, you know, sort of undertake a home visit, I would actually, you know, even if we weren't in the situation we're in, I would not recommend it. There are all sorts of issues here, safeguarding and the like, for both parties involved with the assessment process. And again, coming back to what Pamela said, a lot of the interventions that we're doing remotely are successful. So I would encourage that if you were going to do an assessment, do it with consent and do it, you know, remotely.
That's great. Thank you, Peter. Thank you for that. Anybody else?
One of the things I'd just add, sorry, I can see Pamela putting her hand up. Sorry as I got across you there, Pamela. One of the things I would add is being someone who's done home working or remote working for a very long time, talking to people who don't, there seems to be this massive area of guilt. So they have to see themselves as being on laptops 12, 13, 14 hours. And from what I'm being led to believe, and again, purely anecdotal, but it's speaking to people who don't have the experience of having done this before, is employers are not discouraging that behavior. And that's, I think that is something that's really, really interesting and something that does need to be looked at. Because in some cases, when I speak to people, why do you feel guilty? You know, where's the discipline to turn off that phone? You know, do we really want to go down the way the French have, where they've introduced legislation to prevent employers doing that? I would rather we didn't, but I think that's something that we do need to look at and should be factored in, because a lot of employers are encouraging this because they think they're getting more bang for the buck, because that employee isn't actually in the workplace, you know, using the presenteeism element that Peter's eloquently raised. I think that's really important around discipline and making sure, because smartphones, they're the devil, you know, at times, you know, when you look at them, because before you go to bed, you're checking your emails. You've got to be able to switch off because otherwise you won't sleep, and then the next thing you know, you've got this tremendous feeling of guilt, which it seems to be something that seems very prevalent.
Yeah, it's sad. Sorry, Pamela, you had something? Yes.
Yeah, I think it's just to add to both what Mike said and Peter said, is this leaching in, it makes work-life balance turn on its head, because what we're actually sort of seeing is an awful lot of people are now saying they can't distinguish home life from work life. And so I hear all the time, you know, somebody sitting, you know, watching the TV, but they're on their smartphone or they're on their iPad or something, and I think you're absolutely right. I think we have to stop that. But also going back to John's point, the question that was actually raised about the government doing more, I think there's lack of understanding about doing a risk assessment of the COVID risks, which is what we're all focusing on, versus the other risks now that are going to come out the longer this goes on. So we've talked about mental ill health. That's potentially going to be here an awful lot longer than COVID will be. The same with musculoskeletal and other risks that are going to be created. So I think we've now got to start looking at that broader risk assessment and doing a lot more than we're currently doing, and not just focusing on COVID, is my view.
That's great. Thanks for sharing that, panel. I think it's going to put a lot of light on people to realise that there is life after COVID and many more issues out there alongside COVID that need to be managed effectively. So can I move on to question 4? I can ask Grant to field this one. The question 4 is, we have a member of staff who is unwilling to return to the workplace even though there's no medical conditions that make them vulnerable. How should I deal with this? Grant, have you got any experiences you can share with us on this one, please?
Yeah, so it's certainly something we've had to deal with within the business. I think what we're seeing at the minute, a few people have touched on this already, there's a considerable shift in society's attitude now towards safety. So Pamela mentioned it earlier, the loneliness aspect. You know, people are a lot more anxious, there's fear, you know, all due to COVID, and it's causing people to take a real ownership for safety that we've never seen before. So even yesterday, you know, I was in the supermarket, I saw a woman wiping down every single bit of shopping before she put it in the trolley. I saw another man pointing and instructing someone else to keep their social distance. You know, this anxiety and this ownership to safety it's real. So, you know, returning to the workplace for some people is going to be particularly daunting. So, you know, we need to make sure that we continue with that ownership in that return to work process. You know, particularly anxious or stressed individuals, they're going to cope much better when it's, you know, that approach is personalized and it's just well communicated, that over communication piece. So what I recommend to do is just make sure his or her manager's involved. Occupational health, big piece there, particularly the mental health aspect, they're involved. And the safety team, you know, show that person the controls that are in place. If that means sharing the risk assessment or whatever else you need to do. And also give that employee the authority to make decisions within reason in their return to work. And also, you know, a tag onto this would be a good opportunity for, you know, stress risk assessment to be completed between the manager and that employee with the support from the safety team, just to give that further reassurance. So I think that's how I'd answer that question.
Anybody else anything to add there, my friends?
No, I think it was a great answer.
That's
Yeah,
nice.
I think
It's not from his mouth, and I think, yeah.
I think.
Thanks, Pamela. Yeah, I know he dealt with it first hand, so it was a great guy to field that one. I'm not picking on him, honestly. So, bring us on to the next question, question 5, which really brings us back to one of the most important parts that we all know, fire safety. Gary, it's an interesting one here. Is my company still responsible for fire safety procedures in people's homes if it is their primary workplace? What are your views on this one, sir?
Right, so this is an interesting topic because as with fire safety, it can be interpreted in many different ways, and it's such a broad spectrum as a topic. Ultimately, someone who's working from home in a room that they've converted to a little office in their house, that's part of their dwelling space.
Yes.
So the fire safety order, the legislation, doesn't currently have capacity for someone's dwelling space. If you're a business and you're providing care services, for example, and that person is working in somebody's property for 8 hours a day, every day providing care service to an individual, then as an employer, you're duty bound to ensure that employee is safe and where they're working. So with regards fire safety procedures in people's homes, I would say the answer to that is no. Company is not still responsible unless that place where you're working 8 hours a day is a place which presents additional risk rather than just somebody sitting like myself most of the time on a laptop in front of a screen. So that would be my answer to that question. But I'd like to just stress, take this opportunity, because fire safety is one of those things that people sometimes don't give enough consideration to. During the process that we're all experiencing, limited numbers of occupancy in certain buildings, those buildings will have had a fire risk assessment done on them. Now, your fire risk assessment should be reviewed when you've got a significant change. So as an example, if your fire risk assessment deemed that it was a high enough occupancy in the past to mitigate certain risks, whereby there's lots of eyes, lots of hands to raise an alarm if they discover an alarm in a high occupancy situation. You take that scenario and turn it on its head, and you've only got the upper 2 floors of a 7-storey building occupied. There's less of an opportunity for the effective measures that are in place to be adequate. So the fire risk assessment should be reviewed for the properties that someone is responsible for. So fire safety comes more to the front now when you start to have other things that are taken over and focus starts to go in the wrong direction sometimes. So I hope that answers that question.
Thanks for that, Gary. And I think it comes back to the point I think Peter made earlier regarding the importance of things like your own duty of care at home, to have your own fire safety plans and the likes. It's something I've been quite diligent with in my kids for years. There'll be formally badges in the St. John's, and the one thing I've always drilled into them was fire safety, first aid at home and things like this, because I'm a firm believer that safety and protecting yourself begins at home. So I think that's some valid points there. Thank you very much for that. And I think it makes people think, what's your duty of care to yourself as well in some of these scenarios and situations? Yes, the company is responsible, but there's your own personal preservation and self-preservation for your family as well. So guys and ladies, question 6, which is one for Mike. I'm reviewing my supply chain. How can I spread the risk, and what should I be considering in terms of due diligence? And what are the lessons to be learned from recent events regarding managing my supply chain? Michael, could you share your views there, please, sir?
Yeah, one of the areas that I work within is the evaluation of suppliers across a broad spectrum of industries. And one of the interesting things is we always tend to focus on safety, which is important, obviously, maybe environment, and that's where it tends to end. And that's how a lot of procurement decisions are made. That they perform safely. Have they done any environmental citations, and that's it. And it's how do you make an educated procurement decision on that? And one of the things that has happened since, I would say, March, April time, speaking with clients, is a lot of them have suddenly been let down very, very quickly. You've only got to look at the automotive industry in the northeast of the UK, literally 6 weeks, and it literally comes to a standstill. And this all focuses around the point that Grant made around business continuity. And one of the trends that we're now starting to see, and that has come out of COVID, and you can ask yourself the question, why has it took COVID to raise this as an issue, is business continuity. And the very, very large number of companies just don't even ask the question around that. And the trend we're now starting to see is companies are now starting to make an evaluation on parity with health and safety and occupational health and so on, around what their measurements and processes are for actually managing BCP within their business, and actually making their decisions around that. But one of the offsides of that is that suppliers are really struggling to understand the value of it, especially the smaller, less sophisticated suppliers, and many of them are seeing it as a potential obstacle to getting business rather than a value-added process. It shouldn't take something as serious as COVID to show the value of this. It doesn't need anything particularly complicated. It doesn't need an army of consultants to help do this. And what we're actually starting to see now is that we are having to educate our client supply chains around not just the value of BCP and the issue around managing pandemics or unplanned events, whether that be flooding or whatever it might be, then we're having to do that in tandem with actually getting to the process to actually evaluate their mechanisms for clients. So the trend we're seeing now is clients are now starting to put BCP globally up there in terms of their evaluation mechanism. That's the main thing, and it's also not being restricted to the strategic suppliers. They're actually starting to enforce their tier ones now to start looking at the smaller suppliers as well. And the other trend that we're starting to see, maybe not related to COVID, but it's come kind of floated to the surface on this now, is looking at and assessing the level of subs and sub-subbing within the actual supply chain when contracts are being awarded. Because every time you utilize a third party, you're importing risk. And if you use the example given by Grant, because I've done an awful lot of CSR work in the food sector, there's employment agency workers coming in. You don't know where they were working the day before. You've got lorry drivers coming in. You don't know where they were working before. You know, so every time you do that, you're importing some kind of risk. So you need controls and processes around that. So that's the trend we're seeing in our sector at this moment in time, is making sure that there's adequate information out there. The other thing that we've started to do is provide guidance from the likes of CDC and other European agencies on basic templates, just to get these companies thinking around the issues around COVID and actually undertaking business impact assessments and so on. Because to be candid, a lot of these companies are struggling with basic risk assessment, let alone business impact assessments. So what we're trying to do is we're trying to support them as much as we can, but there is a massive educational process needed here as well. So they're the kind of trends we're seeing in our evaluation mechanism and supply chain risk, and it's not restricted to UK. Where the big challenges are and what we're seeing is in the emerging economies, because to them, you know, they don't have some of the luxuries that we do in terms of working from home or social distancing, even wearing face masks. It's something that can be a real challenge. So that's I think hopefully that summarizes the answer to that question. Yeah.
That's great. Thanks, Mike. We are running tight on time, so I can field the last question, and this is a nice one to round off with for Pamela. It's about basically the third-party test programs. Do any of our network have any views or opinions on the effectiveness of the third-party test programs we're seeing people put in place? Pamela, I believe you've had some experience with some of this that may be worth sharing with the audience.
Yeah, and I assume that we're talking about antigen testing, and therefore it will be very dependent on what industry you're in as to whether it is appropriate to actually do and is actually going to give you any real results. Because if you are in a care home or you're looking after the elderly or hospitals, then to actually do regular testing is good. But if you're a standard workforce and you think it's going to give you any form of protection, then it's going to give you very little, because you can test negative today, but then you could be positive tomorrow. And I'm not sure whether a lot of people sort of realize that. So I think there's something else that's starting to actually emerge now, which is around DNA testing. And it's actually looking at people's immunity. So it's looking at their immune response. So how vulnerable are they? So have they got high levels of immunity or low immunity? What's their respiratory function like? What is their cardiovascular function like? So it's starting to look at the risk factors that are of the vulnerable, But then saying if you're doing that type of testing in the workplace, then you can actually focus your wellbeing programs on protecting immunity, because that's likely to give you a longer term gain than actually just doing antibody and antigen testing, which for a lot of organisations won't really get you anywhere. And there are false negatives and false positives, as with all these tests. So I'm not quite sure whether it answers whoever raised the questions what they were trying to get out of this, but yeah, I think the future is a lot broader than the standard antibody testing.
Thanks for that, Pamela. I think it really does enforce just how limited we are in terms of the fact we're at the infancy of this type of technology in terms of its effectiveness as a prevention measure rather than a control and a control measure. Thanks for that. Now, before we actually wrap up, what I'd like to do, I'd like to have another closing poll if possible. And this closing poll, I'd like to ask the audience, have the 3 panel sessions we've held been useful in helping you deal with some of the challenges that you face with concern to COVID-19? And if you could select, please, yes, very useful, somewhat, or no, but I've enjoyed them. Because really, we'd like to know whether or not this has been worthwhile, whether this should be a closeout point, or whether we should be looking at future events to support you in this manner. So please share your results in this poll now if you can.
Just going to give another 30 seconds, Hugh.
Another 30 seconds?
Yeah.
And I'll be honest with you, all 3 I've found have been really, really informative. It's been great for me as a chair to share with some very knowledgeable, very committed and very passionate experts in their fields, each of whom have had to deal with the issues of COVID in different lights and have shared some very valuable information. So as much as anything else, we made a great network of people, which I'd hate to think that we lost, because I know these people have got a commitment both within their job but personally as well to trying to make things better. So really, it'd be great to see, you know, what you really feel on how well and how effective this has been. Oh, yes, very helpful, or somewhat helpful. That's very positive that 94% of our audience, and for the ones that hadn't found it helpful, at least 6% have said they've enjoyed themselves. So that's great to know. So it's great to see the vast majority of the audience today have got something from it. Now, we're very short on time. I'd like to thank the audience for their participation, but most of all, I'd like to thank our panelists. And I'd like to a quick round of, if there's anything that the panel would like to close out with, if we could start with Pamela, please. Any closing points you'd like to share?
I think personally, I've actually found it quite useful listening to the other panelists and their sort of comments. So I think we can all learn from each other from this. So I've certainly enjoyed it and found it informative. So thank you all.
Thank you. Peter.
I would just reinforce, please, you know, stay safe and keep taking personal responsibility of this particular circumstances we're in.
Thanks. Gary?
I'd like to hope that everybody can try and do what they need to keep safe. Just one quick point on fire. It's important for everybody to understand and remember that all the various protection measures in the buildings that are already there still have to be serviced and maintained, even if your business has shelved the property for the time being. It's important to remember that legislation requires you to still have those systems serviced.
Thanks for that, Gary. Grant?
Yeah, it's been very, very useful. I've certainly learned a lot from this panel. My to-do list has increased. There's a few more things to go out, particularly the remote working from home risk assessment piece. I think we've all touched on the fact that this is now, Gary said at the start, you know, the new norm. So yeah, there's a lot of work to do, but we're all evolving and learning from one another. That's what makes these panels so useful.
Okay. Last but not least, Michael Ford, sir, over to you.
Thank you. To me, I think this has been massive value add. I listen to a lot of webinars myself personally, and no matter how experienced you are, you can always learn. I've learned an awful lot today, and I say to me, these types of webinars, take advantage of them. You know, this is not hard sell. This is actually important knowledge, and to me, it's been massive value add. And to everyone else, just stay safe.
Thanks for that, Michael. And as chair and on behalf of RSM, a big thank you first to Claire, to Suzanne, to Holly for organising these events. But equally important, thank you to all of the panellists for today and for the past 2 events. You've all contributed significantly. We've got a great network now within the RSM, which I'd like to think we, if nothing else, we maintain. We're there to help and support each other going forward. It's been an absolute honour on my behalf to work and share, albeit short 1-hour sessions with all of you. And all I'd like to say, as you said yourself, we're on the start of a long journey, I think, which is going to create a lot more challenges in future. With the level of commitment I've seen from the panellists today and in the previous events, I'm sure we're going to get it right eventually, and we're going to beat this darn thing in the long run. So thank you, everybody.
Thank you.
Thank
you.
All the very best. Goodbye, everybody.
Thank you.
Thank you.
Thank you. Bye.
Everyone.
Bye.
Bye.